welcome to another episode of Safe and Sound presented by Facebook. We are doing this video series of for 12 weeks where we talk about coping with the pandemic. Now, in the last episode, we talked about mental health. My colleague spoke to two experts about how to cope with this pandemic in terms of mental health. And what we are talking about today is information safety. Now, for the first time, the world is dealing with a pandemic at a time when information is widespread, it's easy, it's fast, communication happens within seconds, and that has led to something that experts are calling an infodemic, which has led to a lot of confusion among people on how to deal with the pandemic, how to deal with the disease, how to protect themselves. So that is what we are here to talk about today. We have with us two experts. The first one is Subhra Priyadarshini. She's the chief editor of Nature India. She actively works in scientific communication. So we are hoping to get a lot of useful information and insights on how to consume information at a time like this. We also have with us Dr. Anant Bhan. He is, of course, a public policy and bioethics expert. And he has also been talking very actively about misinformation. He's been dispelling a lot of myths on Twitter, and he has been an important voice throughout the course of this pandemic. Welcome to both of you.
Thank you.
Thank you. Thank you, Mohana.
So, we have spent a year in this pandemic, and even today, we have thousands of cases in India alone every single day. But like I said, this is not just a health crisis. This has also been a huge infodemic. So I will come to you, Dr. Bhan, first. You've been in this field for a long time. And do you think an infodemic of this scale has been experienced before?
Thanks, Mohana. So, we're certainly seeing a unique time in our life. I mean, I think what is also probably happening is that you have a combination of factors. There's certainly a lot of information out there on social media, through platforms like WhatsApp, through newspapers, etc. I mean, we are all, deluged by information, and that predates COVID-19 as well. But with COVID-19, what we have is an inordinate amount of focus on one single disease, because it has impacted our lives in so many ways. The way we live, the way we work, the way we perceive health, etc. And that has probably meant a lot of people are very focused on COVID-19 and, information around it, whether that relates to prevention, treatment, vaccines, what to do, what not to do, etc. And hence, probably you're seeing a lot of consumption of that information as well, because, there might be a lot of information, but are people interested in reading about science, about vaccines, about treatment, etc.? Usually, maybe not so much. So because of the nature of the pandemic and how it is in many ways, impacting us all, I guess we are seeing a lot of consumption happening as well. And that feeds into a factory of people who want to put information out there, some of which is legit and some of which is obviously a major cause for concern.
Right. So, in fact, for the first time, at least in my very short career, there has been a huge interest in science news every day. We had like a lot of people asking questions, proactively wanting to know, about the vaccine, about the disease, about the virus and how it was affecting our bodies. So a lot of technical information was getting out there in a very short time. As a science communicator, Ms. Priyadarshini, how do you see, this entire pandemic so far? How do you think science was communicated? Was there a shift in the way people were looking at, people were reading news and people were writing news?
Yeah, thanks, Mohana, for that question. I think this has been the science journalists, science communicators' time under the spotlight. Yeah, and so we saw a lot of media houses actually turning their political reporters, their health reporters, their economic reporters, their sports reporters into science journalists. And so everybody was on the science beat. And everybody was scurrying to find some science journalist who has had an experience of writing about these things and how to go about it, which experts to contact, which are the legit ones, which are the self-proclaimed experts. So when not to contact a radiologist and when to contact a virologist, kind of thing.
So I think a lot of us learned these new terms. I mean, epidemiologists came into vogue, and all of that happened during this time.
Yeah. So the epidemiologists, I call them the next spotlighted people. I think we have all have had our share under the sun, and if it was some time for any of us to really shine and do stuff in a manner that should be done, it was this. None of us had a pandemic experience earlier. We all had SARS and MERS, which were like younger cousins of this SARS-CoV-2. So I think, yes, one was that. But if you ask me about the challenges that we all faced in trying to parse, if you will, information from misinformation, or legitimate sources from not so genuine ones, then I would say the number one thing that came to fore for all of us as journalists and communicators was that we were struggling initially to figure out the virology, the epidemiology of the virus and of the disease spread. It was spreading fast. It was across the world. It wasn't like I have to report India. Every story was a global story. So even if it was a Bangalore story, it was still making global headlines. So those were the things we were trying to sort of come to terms with initially. And coming to the research journal side of things again, even that was a Herculean task. That was something that we all saw unfold in front of us. The volume of COVID-19 research being generated globally was unsurprisingly high.
That's right. That's right. I mean, there were days when we had to read through papers after papers, and for people like us, we ourselves have not. There are parts of science which we have not studied, which we were reading for the first time. Absolutely. But scientists themselves had a task ahead of themselves.
Truly. So everyone, of course, wanted to share information that may prove useful in addressing the pandemic in any way. So there was so many papers that were coming in. And so the volume and the speed with which research was being produced and still is being produced is challenging for everyone concerned to get their heads around. The quality journals, of course, are highly selective in the papers that they send to academics for peer review, assessing all submissions very, very carefully and choosing only the research that they believe to be the most promising and significant. Much of the research that has emerged on COVID-19, particularly during the initial phase, was less extensive than in normal times. Obviously, because of the speedy nature of the studies, and also because there were no large-scale studies based on years of previous work. This was a brand new virus, right? Right. So that was one challenge. And then preprints. Preprints have played an important role in disseminating initial findings very, very rapidly. Observational studies were also vital, but then which preprint to sort of look at and which not to, and to make sure that you inform your audiences, your readers or your viewers that this is a preprint, it's not peer reviewed. That was also something we all learned.
Right. So we'll come back to the role of journals, and in fact, that is actually the next set of questions that I had. So when we talk about misinformation, there is a lot of emphasis on finding out and reading from authentic sources. Now, we saw a lot of these authentic, so-called authentic sources also falter. So I would ask Dr. Bhan to, weigh in over here. When we saw some advisories coming from the ministry itself, from the Ministry of Ayush about the Ayurvedic medicines. And in fact, we did write about it, but the problem was when we looked at what research was used to back those advisories, we did not find good research backing the advisories. So what do we do? What does a layman, how does he evaluate, he or she evaluate an advisory like that coming from an authentic source, which is the government?
Sure. So I think there are certain assumptions one has to make when you receive information and what from sources that you consider authentic. So one example obviously would be the government. And, an assumption I would make is that any information which is being relayed from official sources would be based on evidence, would be based on looking at data, facts, and then coming to a conclusion, which is then promulgated as something which should be applied to the larger population. The problem, as you're rightly pointing out, was there with some of the advisories, some of the guidelines which came in, that part was not clear, and it was very rapidly criticized for that as well. And that, I think, is one of the advantages of social media. I mean, we can talk about the disadvantages in terms of the misinformation, but the fact that there are many people out there who will receive this information and very quickly provide feedback, positive and negative around it. But I think it also tells us something, that in the race to be wanting to be seen as doing something, sometimes both journals, journals have certainly faltered. There have been many, as you know, retractions as well in major journals. But the government also, I think, sometimes has probably gone ahead and put out information. And sometimes it's different arms of the government who are not exactly in sync with each other in terms of the information. So the Ministry of Ayush might say something, and the Ministry of Health might not necessarily agree with it, but they are both seen as sources of information from within the government. So as a consumer, I might not be able to discern a difference, but there might be obviously a magnitude of difference in terms of what is evidence-based and what is not evidence-based. Then maybe secondly, the role of the intermediaries. So the media is a good intermediary example in terms of sifting through what is out there, what is also obviously fed to them through a PR exercise. You obviously get a lot of public relations material. Some of those are preprint, some of those are press releases, and then, certain claims are made. And it might not always be possible to have judgment, but I guess, putting in filters, either by reaching out to independent experts or having in-house science and health journalists with experience who can look through and ask critical questions before publishing anything. So that what we don't do is then just go ahead and put out information which obviously has not gone through proper scrutiny. Journals have the process of peer review and editorial review. Media outlets might not. And I think part of the challenge one has is that everyone is racing to come out with the first breaking news on a new vaccine claim or an efficacy claim or a new drug or some kind of an intervention which they feel might be of interest to their readers. But I think we also need to all recognize our responsibility to ensure that we put out that information which has gone through some level of checks internally and get feedback where required from external experts. Information which goes once out there can be recycled multiple times. Even if you retract it later, even if you come out with a clarification, it will stay on WhatsApp groups for ages, for months, and many of us have seen that.
Right. So that's what I think that's the key point that both of you, pointed out here is the requirement of the speed. How fast the virus was spreading, the requirement of everyone wanted to learn as quickly as possible. They were constantly reading about it, and the information was also changing. Like, for example, when the pandemic began, we heard from experts, like doctors was asking you to not wear the surgical mask. And as we progressed, we learned more and more about why masking was important, and now that is a universal norm. Everyone is wearing masks, and it is well understood, it is well accepted that it's helping curb the spread. So I think that is something that readers also need to keep in mind, that information is also changing. and they need to be updated all the time. Even if they've read something yesterday, that might be changing the next day. So in that sense, that is where our preprints and our journals, they already come with an inbuilt fact checking mechanism. But Shubhra, like you said before, that about these preprints and the journals, we saw Lancet retract a very important paper. That it had huge implications for ongoing trials at the time. WHO was responding to it, and what have we learned from this exercise, and more importantly, what exactly are retractions? Are they always a bad thing?
Yeah, very good question. I think I've answered that many times during the pandemic, but here goes. Retractions are healthy. Retractions are a journal's way of saying, I goofed up, I'm sorry. And I take back what I said. Just like you said, the pandemic has evolved. Our knowledge about how science is done, the public's knowledge has also evolved during the pandemic. So retractions have happened forever, right? But the most visible retractions for us were the ones that happened during the pandemic, because of course everybody's lives are at stake. Government's policies are at stake. There's so much at stake, and so we cannot falter with a scientific manuscript during this time. Having said that, just like we have evolved about how science is done in the public perception of how science is done, retractions themselves have also started to wane down. You haven't seen another retraction during the pandemic, right? You've just seen a couple. So you will have noticed that retractions, which means again that journals are taking back what they had published and saying we have new knowledge or we have faulty knowledge on this one. So we are saying we want to take this back from our publishing, we unpublish it, so to say. So just as we had seen these retractions happen, we haven't really seen as many after that. And you will not also notice the media hype on retraction, even if a small paper was retracted somewhere. Retractions are happening every day.
Right.
So you won't notice all of those. What was your next question? Sorry.
So I just wanted to ask that, what is the value of these retractions? They are part of the process of science.
They're part of the rigor of science. You may have published something, but you want to take it back because of faulty knowledge or unclear knowledge or whatever. There could be conflicts of interest, like in this case there was. So there are many reasons why a paper can be retracted. Now, coming to the question of how we accessed journal knowledge, like how journalists were able to get to these significant stories published in journals, high impact journals or whatever, preprints, whichever they were. How was that process happening during the pandemic, and how is it still happening? So many newspapers do not have science journalists. Very few in this country, at least, and globally also. And very sadly, there were some science bureaus which were rolled back just before the pandemic happened. So and those people were cursing the stars for why else had we nurtured these science journalists if not for a pandemic. So whatever. So the question then was, how do we train immediately? How do we build capacity of these science communicators or journalists in between a pandemic? Mm-hmm. So it's just the same question that we were asking about our health systems. We knew what was collapsing. We knew what was wrong. We similarly knew what was wrong in our newsrooms. We continue to know. But is the pandemic a right time to sort of course correct by way of having more data journalists, by way of having more health journalists, by way of having more science journalists? But yeah, lessons learned, certainly.
Right. So, what are the things that a reader can do whenever they are looking at any piece of article? What are the red flags? When I start reading anything that may even be on an authentic on an otherwise authentic source. What are the things that should stand up as red flags when I read any article?
Yeah. So the first thing I would say is any story that is based on a science background has to have some sort of a backbone of scientific peer review, because that's a gold standard. And journalists or editors are not scientists, finally, right? So they are banking on stories which have a sound scientific background. So if you find a story which is not talking of evidence, not just by way of peer review, but also quoting the right experts, or speaking to in terms of data. It doesn't have a sound backbone of all of these things. You should sit up and take note and say, "Hey, this somehow doesn't look okay to me." The second thing I would say is, if you've gotten a WhatsApp forward, for instance, and somebody is notably saying that this is something I received from WhatsApp and forwarded as received, kind of things, we obviously take that with a pinch of salt and try to figure out if that has a sound, balanced approach towards rigorous scientific evaluation.
Right. Dr. Bhan, would you like to, add some points to this? What are the things that one should look for when reading any article?
Yeah, so as Subhra was saying, you have to be a bit discerning because there is a lot of information out there. In fact, there is a paper out there as well as also I think Subhra was alluding to. That with the infodemic, we are seeing a whole lot of papers, which is good because we need more science, but that also can be detrimental to the cause of all science, which is to say science beyond COVID-19, because many journals, publishing houses have focused on COVID-19 because of the interest around it at the cost of non-COVID-19 science and for that matter, even healthcare. But that having been said, to your original question, I think what is important is hence, whenever you receive any information, whether that be a newspaper article, whether that be actually a preprint, whether that be a finally published article, whether that be a WhatsApp forward, I think the standards are similar, which is to say that look at who's done that study, if they've published it, where they've published it. Is this a form of a press release versus something which is reporting a scientific finding, and how it is being reported? If you see anything which is magical, it's probably not true. Anything which, for example, claims 100% efficacy, highly unlikely that it's going to be true. And if it is really going to be true, then you're going to hear about it very soon from multiple outlets, including authentic outlets. But if you have any company, any research group claiming something which seems unlikely, it's quite likely unlikely, and hence maybe doing some level of your own background searching before you press that forward button, especially if you're on forward, or that share button if you're on Facebook, or your retweet button if you're on Twitter, etc., is a good idea. I think that level of individual responsibility is something we all need to reinforce. Just in the same way we talk about our individual responsibility around mask usage, physical distancing, hygiene measures, I think we also need to have individual responsibility built in terms of what we need to do to control the infodemic and how we can promote the spread of more information, which is valid. I think that is a social good. Actually, we all need more information to be shared, which is legitimate and which can help all of us to be more cognizant of the truths around COVID-19 as we are learning about it. As you were also alluding to, it's a disease which is novel. The virus is novel. The immunopathology is novel. We are learning almost on a daily basis new elements about this disease. But that having been said, it's important for all of us to learn collectively, and the scientists and the healthcare workers, our medical staff, etc., can be at the forefront of that learning curve. But we all need to imbibe that information in terms of how it impacts us. But that needs to be done through credible sources and in a way that we are all obviously digesting it properly and understanding the takeaways and not being swayed by information which might be clearly untrue.
Right. So now, what I think the sense that I'm getting here is that in consuming any kind of information is no longer a passive exercise. It's not something you should not just be scrolling through your social media, just looking at headlines, but rather go and click on that link, read what is inside, and at least try and get a sense of where that information has been collected from, so that you have a better sense of what that news really says. There is a lot more to the news than the headline. We obviously we are not able to fit in everything in those 100 characters or so, whatever YouTube or social media allows. So is that what you're saying? That we have to become more active when it comes to reading any kind of information and evaluate it for ourselves.
Yeah, absolutely. I would also think, like Anant has mentioned, miracle, hope, cure. These are red flags for me. I mean, I have to really read it twice, thrice, consult with someone who knows better than me, and get to the real experts. That's also something that I previously said and can't emphasize enough, is that who are these real experts? Who are these people who really need to be consulted? And we all are on the same page when we're talking about whether it's the ministry, whether it's Ayush, whether it's your neighborhood doctor, who exactly is the authentic person to get to. So if you're talking about the virus's protein code, then talk to a virologist. If you're talking about or wanting to know more information about how the virus is spreading, talk to a public health expert or an epidemiologist. If you want to know about the economy or the politics around the virus, or for instance, the story of now, which is gaining much traction, the vaccine nationalism story, then talk to a policy expert who knows better. So,
right.
Yeah.
Right. So basically, like getting, you cannot just get everything on a platter here. We really have to be very careful about where we get our news and how we process it as well. When we read it, we have to educate ourselves constantly to ensure that we have the updated, correct, and authentic information, so as to make sure that no one is in the harm's way. Now, we are coming towards the end of this episode. So before we leave, I would like for you to, mention some sources that you think are the go-to, who have been doing good work, and the ones that can be trusted as authentic sources of scientific information during this pandemic.
Anant, you want to go?
Yeah. So, I mean, even though we did criticize them, official channels of communication usually have updated information, at least the government version of it, and also have sometimes simplified information around testing, around where you can get tested, where you can access treatment, what are the current numbers of infections. So in India, you would look at the Ministry of Health and Family Welfare's website. You might go to ICMR for more information around testing, what is the current standard for testing, where might be the officially recognized centers for testing, what are the official numbers. The World Health Organization has a very detailed set of information available. Many well-established public universities and private universities have also set up portals where information is available. You have journals like Lancet, BMJ, JAMA, the Nature group of journals, which Subhra is associated with, which also have specific web pages or collections of information which is accessible. You have publications, most of the credible publications, both online and print, also have dedicated clearinghouses of information around COVID-19. That having been said, as we were reinforcing, I mean, all of these are usually verifiable sources of information and usually are evidence-based, but I think you also need to apply your own personal filter, because there can be sometimes information which can go through the cracks and go up there, which might still have questions attached to it. So whenever there is anything where there is an element of doubt, do some primary research of your own, talk to friends who you trust, who you think are more discerning. And I think that's extremely important now at the time of this pandemic, to ensure that we are able to both digest information, which is hopefully fact-based, and also that we share wisely and not without actually paying enough attention to what is being shared.
Right. Subhra, would you like to add to that?
Yeah. So the websites of CDC is my go-to for many things, not just about the numbers or the data, but also for the useful information they put out. So is WHO. They do a great job of sort of scotching misinformation. In India, of course, the Worldometer, where we all go to for the numbers. In India, I've also very often gone to Covid-19, which is a portal by scientists who have come together as a public service venture. I've also gone to Health Analytics Asia, who do a great job of crunching data. So what they do is basically look at Asia numbers mostly, and how governments are making decisions around those data sets. So those are some of the authentic ones for me.
All right. So I think we have a lot of things to work with. I hope the readers have understood, how you need to get proactive and really look into what is the content, what is the information that you're consuming before you hit the forward button. Now, thank you so much, Ms. Priyadarshini. Thank you, Dr. Bhan, for joining me today. And I do hope that we, recover from this crisis very soon. It's been a very, very long year. But do remember that we are still very much in the middle of a pandemic. Do keep your masks up, your hands washed, and maintain social distancing till such a time that we are blessed with a vaccine. Thank you again, and do look out for the next episode of Safe and Sound. We will be broadcasting every week for 12 weeks. Thank you so much.
Thank you. Take care. Bye.
Pleasure.